Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi, everyone. Welcome back to the show. It's great to have you here today. Looking forward to bringing back another viral-based podcast, this time talking about the post-inflammatory issues that many people are suffering when they are being exposed to the current virus out there right now. We all know the pandemic, the virus that I'm speaking about. I will try not to use the actual virus name just for simply being banned on most social media, as many people are. And what I want to do is I want to really dive into this show, again, give you unbiased advice, give you exactly what the research is showing, the most common symptoms, because it is real, and then giving you specific ways in order to be able to overcome it. So the goal of every single show on the Cabral Concept is to give you the unbiased research. Where does that come from? It comes from the actual science, and it comes from the research studies. And then what I do is I blend that with 20 years of working with private clients really all over the world and helping them with many of the specific issues that we're going to talk about here today. So I like to give you the real world, and I like to give you the research as well and make the two work seamlessly together. So that's a big part of the work that I try to bring you. And what I always want to share with you is that it is unbiased, that I simply don't have that dog in the race, that I'm only looking to try to serve to the best of my ability to help as many people as possible. And that's why I haven't done a virus-based update show in quite some time. One, the information hasn't really changed. Yes, we're seeing more cases. If you go back and you listen to my previous shows, you'll absolutely see that this is what I said had to happen anyways. Like, this is how a virus works. We know this is how a virus works. And in particular, this virus is actually much more contagious than even a virus such as the flu. Now, that does not mean that it's more deadly than the flu, but it does mean that it's more contagious. So more people will get this virus. That does not necessarily, again, mean that more people will die all around the world, although we do see there is a mortality rate. Again, nothing like they described it to be, but again, a fraction of 1%. That does matter. Like, it matters because many people are being exposed. Now, are the levels to what they are saying are caused by mortality for this particular virus? They're not. And again, like, if you look at the unbiased research, you can just see what Johns Hopkins put up the other day, which was subsequently, they were asked to take it down very, very quickly. But by the power of the internet, you'll be able to find it if you simply look at mortality rates over 2020 by Johns Hopkins, and you'll be able to find this. Of course, me saying that, I'm sure, will further get this podcast banned. But I do my best, and it's always available. So today, the podcast will always be found at stephencabral.com/1776. So it might, be banned on YouTube. It might be banned on Instagram. It is what it is. But again, for no reasons. Like, I'm not trying to give you anything except the truth. And when you look at the actual numbers, you will see, yes, there are many people, again, it's unfortunate, but there is an average age of mortality to this, and it is still hanging out around 78 to 80 years old. Some say 79, some say 81, somewhere around that age range. And when we're looking at total mortality, we're looking at about the same for a given season, such as which they compared it to as 2018. So again, do I think that this virus is serious? Absolutely, and I always have. I also think the flu virus is very serious. I mean, that's the truth, because it can lead to pneumonia and a lot of complications as well. So the research that I'm sharing with you, my hope and optimism is not to be misconstrued with my belief that this is a serious virus, especially for about 50% of the population, meaning if you're at higher risk, if you have cardiovascular issues, which I'm going to share with you today, higher blood pressure, type 2 diabetes, or you are more, not just overweight, but more towards obese with a BMI above 29 or so, you're going to be far more susceptible to not a great outcome. I mean, that's really what we're talking about. Now, when we look at all the people with cardiovascular disease, again, it's about 10.5% of those people die when they get this virus. Now, that's not a good thing, right? But we have so many people with cardiovascular disease, and when we look at a lot of these studies, again, I'm going to share with that just in a minute, so I don't want to give it all away now. But I just want you to know, along the whole time, I want you to know that I believe that this is a serious virus. But I've said before, this is what happens when we have a virus that runs amok, this time globally, that it cannot have any more hosts. It's going to continue to move and move and move until there are no more hosts. Or we have some way in order to create herd immunity to a faster degree. That's really it. And again, going back to not a lot of people, because a lot of people understand what I'm saying and how I'm trying to help. But there are also those people that say, you're against wearing masks, how dare you, all of that. Like, that is coming from your vantage point. Again, like, I'm just sharing with you the research. I actually do believe in masks, and I've said that before. I believe in the masks that actually work. I don't believe in wearing masks for the sake of wearing a mask that does not do anything, that leads to a false level of security and is harmful to those people more at risk. So if you're saying just wear a mask, I'm saying that is not correct, because I shared with you the research. Single-ply, homemade cloth masks do almost nothing. Like, literally nothing. The thin gator masks that you just pull up over your nose and mouth, not only do they do nothing, they spread the virus faster. And you can go back to my podcast on that. The masks that work are the light blue surgical masks that are 3-ply when fitted tightly and correctly. They're about 70% effective. The only masks that we know are effective are the N95s when worn correctly, meaning like you don't touch the inside of it, you keep it all the way tightly fitted around the mouth. That works. And so I'm not anti-mask. I'm not saying, I've never once said that. I keep all of my podcasts up for the last 5 years, right? 5 years I've been doing this podcast. I speak for about 10 hours a week on video and podcasts. That's a lot, right? Like, that's, how many hours is that? 2,500 hours just of me doing videos over the last 5 years or so. I'm going to mix up my words sometimes, or going to mispronounce a word. Like, those things are going to happen. Everything is up though. I don't take anything down, because I have not said anything that is going against the research of what actually true. People may not like it if I say a gator mask doesn't work or a homemade mask does not work, but I'm actually sharing that out of benefit, that I'm trying to help people realize. If your mom, your grandmother, your grandfather, your whoever leaves the house, or your child with an autoimmune issue, whatever it might be, they leave the house with a mask that is just homemade, or a gator mask, they're susceptible. That's why I share those things. They are susceptible. So you get them an N95 mask, or you get them a tightly fitting 3-ply surgical type mask. Like, those are the ones that we know work. Wearing a face shield in public doesn't work. It works for you, not to spit literally on someone else. That works, but you can breathe in and around that. So I just want to spread the truth, and that's what today's show is all about as well. So now that I got that out of the way, I feel a little bit better about saying that, because again, like, I don't want to be painted into this corner or making this political. It's not political. It's about helping people. That's it. I mean, that's really what it's all about, is helping people through the truth, right? The truth behind the research, no agenda. Okay. So what is this post-inflammatory, post-viral syndrome, or post-viral inflammatory syndrome, that a lot of people are suffering with after getting this particular virus? Well, when I say a lot, I mean fractions of the percent of people that get it, but still, it's enough people that this is causing an issue. Now, the truth is this: we see this with almost all viruses. Mononucleosis, Epstein-Barr virus, we see it with flu viruses. So this is not unique to this virus. So first truth is that this is not unique to this virus, okay? Very, very important to say that. But now we're bringing it to more public awareness, and that's a great thing, because 20 plus years ago, when I had Epstein-Barr virus, when I had Addison's disease, when I had these things, I was one of those people with chronic fatigue, immunodysfunctional syndrome. I had myalgic encephalomyelitis. I had these issues that weren't really talked about in the late 90s. They just weren't. Like, and most likely your MD wasn't going to believe it in the first place because there wasn't a real diagnosis for it. Now we know there is. But what are the symptoms of that? Well, the symptoms of these post-viral inflammatory issues are flu-like symptoms, like joint pain, weakness in the muscles, your legs feel like a ton of bricks, that it's hard to move them. You're exhausted. Walking up the stairs is tiring. You have brain fog. You're more fatigued and tired during the day. More exhaustion. You might succumb to something like an Epstein-Barr virus, more prone to herpes outbreaks, anything that's going to be a stressor on your immune system overall. And we'll talk about why that is in just one moment. But I also want to say this, is that if you get pneumonia, if you get a strong common cold, if you get the flu, if you get those Epstein-Barr virus, or even that you've had a herpes outbreak that could then lead to this, like those viruses can also lead to the brain fog, the fatigue, the joint pain, the flu-like symptoms that are ongoing. What's another big one? Confusion, sore throats, swollen glands, trouble concentrating, headaches, and you'll often hear the word thrown out, anergia. And anergia, I just want you to know, it's a medical term we like to use just for essentially fatigue, muscular fatigue along the body. What I'd like to share with you is this, though, is that from those, we can actually end up with more autoimmune-based issues or inflammatory-based issues. So I just want you to know that that can lead to then, if it's chronic, other health conditions. That's why we want to take care of this now. So I want to go over this with you today. The other one that a lot of parents have written into me about, and a lot of my daughter's classmates, they'll ask me as well, like their parents, what about Kawasaki syndrome or Kawasaki disease? Now, so I just want to explain Kawasaki disease. There's been, and again, let me see if I have the stats here for you. It looked like, well, let's explain to you first. So basically with Kawasaki, we are looking at unlike a congenital heart-based issue, so congenital meaning your child was born with it, there is inflammation in and around the heart in some children. And this is with typically like no previous conditions. This happens to about 9 or 10, up to 20 people in 100,000 kids under the age of 5. This is United States stats alone, although more frequently diagnosed and seen, or at least talked about in Japan. One other thing I want to talk about is there's a swelling of the blood vessels. And yes, there is a serious risk for this. Now, I also want you to know that this is by Dr. Owen, I believe. I'm going to link everything up for you today. So if you want to go to stephencabral.com/1776, I'll link up all the research and studies if you want to go a little bit deeper. I believe this is Dr. Owen, but again, I will link that up, who works a lot with children with Kawasaki disease. Most children who get Kawasaki disease and those who may experience symptoms of this new inflammatory disease should recover. So like that's the thing, is like we have a small percentage of children that may suffer from this. It looked like about 10 kids, so about 10 children, not a big number. This was latest statistics, haven't been updated since about beginning of June, but we know that it's a small percentage, small amount of children. And when we look at that, it actually showed that, I'm going to read it specifically for you. Most children that are admitted to pediatric intensive care units had other health conditions such as cancer, obesity, or diabetes. So there are often other underlying conditions. And it shows that only 2% of confirmed viral cases, meaning this virus going on right now with children under the age of 18, that's it. So about 2% of cases for all these viruses are from children under 18. The issue is this. It's actually misleading because they're counting teenagers as children. We really want to block that, stop that around 12 years old. Because when we look at 10, 12 years old, under 10, very, very unheard of. It's almost none at all. It's basically less than 90% of kids, like 90% of children children, not teenagers, are not even going to show any symptoms for this particular virus if they do get it. It's not completely known, but the immune system seems to be better balanced, and there isn't this massive production of cytokines, which is the cytokines which are causing now this post-viral issue. So again, I just want you to know that unless your child has a true underlying health condition, the likelihood that anything happens to them with this virus or that they even show any symptoms at all is very, very small. And I gave those statistics before as well. So I don't want to go too deep into this. So now what though is this post-viral syndrome, this inflammatory syndrome? What do we know about it now that this virus has been around for what, about 8, 9, 10 months that we know, okay? So let's go directly into it. So this particular inflammatory issue is a buildup of pro-inflammatory agents. And I'm gonna give you the exact quote. I'm gonna tell you about what all of this means in just a moment. So it's a buildup of pro-inflammatory agents, especially post-infection cytokines such as interferon gamma and interleukins, which have been hypothesized to affect the neurological control of the glymphatic system, as observed in chronic fatigue syndrome and myalgic encephalomyelitis. The buildup of cytokines in the central nervous system may lead to post-viral symptoms due to pro-inflammatory cytokines passing through the blood-brain barrier in a circumventricular organs such as the hypothalamus, leading to autonomic dysfunction, manifesting acutely as high fever, and in the longer term of dysregulation of the sleep-wake cycle, cognitive dysfunction, and profound unremittent anergia. All characteristics of CFS and ME. Whenever you see that, it means chronic fatigue syndrome and myalgic encephalomyelitis. Myalgic encephalomyelitis, I've spoken about that before in the podcast. That is basically daily flu-like symptoms. When I was suffering from my diseases many years ago, imagine having the flu every day of your life. How miserable that is. Well, that was my life for many years. And people wondered why I wasn't necessarily all that happy of an individual. Think about having the flu every day. It is miserable. It's a miserable way to live. The good news is you can overcome this, even if your medical doctors don't believe you, right? Or they're unwilling to give you these CFS diagnoses. All right, let me go on for the quote. As happened after the SARS outbreak, a disproportion of this virus affected patients may go on to develop a severe post-viral syndrome we term post-virus syndrome. Now, insert the C word for that virus, and there you go. A long-term state of chronic fatigue characterized by post-exertional neuroimmune exhaustion. Now, what does all of that mean, right? Well, here's what it means. So basically, you get an infection in your body. It could be bacterial, or it could be viral. All right, here's what happens. Because again, it can happen with the flu. It can happen with Lyme. That's why I always tell people, oftentimes, it's no longer Lyme disease. It was Lyme disease when you got it, and it's no longer Lyme. You're looking at a post-viral or post-bacterial infection right now that is affecting the mitochondria, and it has disturbed your autonomic nervous system because of the inflammatory-based process. That happens in the brain. Let's talk this. Let's create normal speak out of this. All right, so what happens? Well, the hypothalamus regulates your endocrine system. That means it regulates the production of cortisol. It regulates the production of your hormones like testosterone and DHEA and all of these things that help to balance the stress hormones or the sex hormones, the ones that keep you feeling good and keep your body young, and the ones that cause aging at a faster degree and, when unchecked, higher amounts of inflammation. Well, if we have unchecked levels of cortisol as well, what happens is we end up not producing as much melatonin at night. And if we don't produce as much melatonin at night, well, we can be more prone to what? Depression. Right? That's a big one as well, because we're not producing as much 5-HTP. We're not producing as much melatonin. Melatonin and 5-HTP are intimately connected. Well, what do you need to make those as well? Well, you need magnesium, you need B vitamins, especially B6. What happens when your body gets really stressed out? Well, it gets depleted of B vitamins, right? It gets depleted of zinc. So how are we able to fix this process? Well, we'll get to that in just a moment, but I want you to know that regardless of whether you're going to work the plan or not, it says this, again, like they give you these, post-viral inflammatory. Yes, a lot of people do suffer from that. There's no doubt about it. I suffer from it. I know it's a real thing. I had that previously when I got very, very sick. Here's the issue though. Post-viral syndrome is temporary. Although the effects may linger, many people expect their symptoms to resolve resolve within a few weeks. So again, I know the media is going to bring you the worst case scenario, the things that happen to 0.01% of the population, and they are real, and I don't deny them, and I'm going to try to help those people on this show here today as well. But most people, regardless, recover in about another 3 or 4 weeks or so. Might take 6 weeks, might take a little bit longer, but their body rebalances if they're doing the things to rebalance their body, right? That's a big part of it. All right, in some cases though, symptoms may last for longer, up to several months. A smaller study in viral immunology reported that 31% of people experienced prolonged fatigue of longer than 6 months when they suffered from West Nile virus. So why would they suffer for longer? Because the body was never able to get back in check, be able to rebalance itself. Why are some people able to rebalance and others are not? Well, a lot of it has to do with the underlying conditions first. Were you previously dealing with a heart issue? Were you previously dealing with blood pressure issues? Previously dealing with blood sugar issues? Previously overweight or obese? These things lead to higher amounts of inflammation in the first place. It goes back to the rain barrel. It really does. So let's say you're dealing with cardiovascular issues, autoimmune, viral issues, all of these different things, right? So now all of a sudden you get this virus. Again, whether it be the flu, pneumonia, whether it be Lyme, whether it be this particular pandemic virus right now. Okay, all of a sudden you get that. Now your rain barrel is really overflowing. And what do? Well, you already were not in great shape before, like meaning health-wise, and now you're worse because you've added more to that rain barrel in order to fix. Well, the thing is this. A lot of people now in the media saying, well, now it's leading to long-term heart conditions. It is not leading to long-term heart conditions in anyone but fractions of a percent of the population. So please do not let the media fear-mongering get you on this as well. Here's the study. The study was literally done from January and February in Wuhan, China, and it was done on 416 adults. And let's see what else we have here. A total of 82 patients ended up having cardiac issues. These patients were an average age of 74 years old. Again, older population. Do I believe that we need to save our 74-year-olds? Yes, I absolutely do. Again, I don't want people to misconstrue these words. Every life is valuable, okay? I want to just go through this here. But out of the people whose average age was 74 and those 19% that were hospitalized had this, they had comorbidities of hypertension, 60% did. Diabetes, 25%. Coronary heart disease, about 30%. Cerebrovascular disease, about 16%. Congestive heart failure, about 14.6%. Cancer, about 8.5%. And the mortality rate among patients with cardiovascular injury previous was about 51.2%. That's an enormous amount. Why? Because this virus seems to affect our lungs first and then move to the heart for those people that are hospitalized. Well, those people that had a pre-existing heart condition were actually much more likely when in intensive care to die versus those people that didn't already have a heart condition. They might have other comorbidities, but not a heart condition. That was only at 4.5%. Now, you might say, well, 4.5% is still a lot. I agree with you. But these are people that were already in intensive care. This is not even people that get the virus, recovering from the virus, are not feeling well. These are people that are in the hospital, have stayed for about 10 days, and are in intensive care. So we're looking again at fractions of a percent. Do these people matter? They absolutely do. But went on to say this. Besides the average age range, the comorbidities, that cardiac injury defined by levels of protein called troponin, which is measured in the blood. Dr. Gudimetla, I apologize, mispronunciation, explains that detecting the abnormal troponins in a critically ill patient with this particular virus isn't likely to alter management of the patient, meaning that most people who have this issue in the hospital then go on fine to recover if they recover, right? That's a big part of it. So the researchers also address potential drug interactions in these patients, meaning some of the drugs they were using may have inadvertently led to some of these comorbidity, or shouldn't say comorbidities, mortality rates as well, simply because they were doing their best. It's not like these doctors aren't doing their best. They are. Some of the drugs may have interacted and actually caused some of these heart conditions as well. Again, I don't think that's a fault of the doctors. They're doing their best. These people are in intensive care, and this is a new virus that we haven't necessarily seen in this exact form before. So, okay, I just want to leave you, I've talked enough about myalgic encephalitis. I don't need to really go back on that. That's the fatigue, the flu-like symptoms, the exhaustion, the brain fog. That's what a lot of people are suffering from. So what do? Well, we need to do this. We need to focus on rebalancing inflammation through not specifically addressing inflammation. So yes, inflammation matters, but why is the body dysregulated in the first place? That's what we need to look at. So there is a typically hypothalamic pituitary issue caused by the free-floating cytokines in the body. So yes, we need to reduce total cytokine load. How do we work on that and re-regulating the body? We do that through relearning that circadian rhythm. We do the things that we would do to get well, and we do them for a little bit longer and a little bit more. So now is the time to focus, like if you're dealing, or any of your family members are dealing with some of these post-viral syndrome or inflammatory issues, we work much more on inflammatory diet. So we're really working, again, inflammatory diet, 7 to 9 servings of fruits and veggies every day. This is the time to focus on these brightly colored fruits and vegetables, highly anti-inflammatory. There's no doubt about that. Monounsaturated fats. What would monounsaturated fats be? Well, the easiest ones are nuts or seeds, but really the best ones are olive oil and avocado. So easy ones to look at specifically right there. And then protein, yes, our bodies need protein in order to regenerate. Somewhere about 0.8 grams per kilogram of body weight. Easiest way to think about it is take your body weight or your ideal body weight and divide it in half and eat that. Honestly, let's make things easy for ourselves. Split it over 3 meals per day. Very, very simple way to look at it. Try to eat easier to digest proteins right now. Your body needs its energy for repair. In terms of exercise, don't just dive back into your gym routine. Don't try to pick right where you left off. I want you to ease into your movement. First, the walking. Follow my graduated exercise protocol. Begin to implement these things. Walking first, then some light cardio. Get the blood flowing. Then the body weight exercises. Again, continue to work up that ladder. Work on stress management. This is not the time. You have time, but now is not the time to take on a lot of new work stresses, relationship stresses, whatever it might be. Get your sleep, get your rest, get to bed earlier. You need your 8 to 9 hours of sleep. Get to bed earlier, 9 to 10 p.m. at the latest. Sleep, be in bed. Even if you're not sleeping 8 to 9 hours, use a good sleep-based protocol to get you to sleep right now. You need to reset the circadian rhythm. You might need the liquid melatonin. You might need the sleep help support. You might need the magnesium. You might need all of those things right now. The adrenal soothe at night, right? Those are the things that are going to reset that circadian rhythm. A couple other things that I just wanted to mention to you. This is not the time for longer fasts, right? Don't deplete the body more. Yes, I still believe 12 to 14 hours a night, no doubt about that. Stop eating by 6 p.m., start eating again at 8 in the morning. You can do that. That's a normal fast. Don't exhaust the body though. Feed it with lots of good nutrients as well. And then the last part I'll give you is just really keeping that mindset positive. You will overcome this. Your family members will overcome this. Use good nutrition. Make sure you get in your vitamin C. Make sure you get in your vitamin D, your zinc. You're taking the daily foundational protocol. I would do level 3, and that you are continuing to move forward, that you know that it's not a matter of if you're going to get well again, it's simply a matter of when. It's just time. Whether it be weeks or a couple months, you'll get there, you'll ease back into it, and you will be happy and healthy again. So thank you so much for tuning into the show. As always, I appreciate you. If you felt the show was helpful, please do feel free to share it with anyone you believe it could serve. Take care. I want to sincerely thank you for your support of this podcast. I couldn't do it without you, and I mean that. I truly do. I also want to make sure you knew that we now have multiple ways for you to find your answers to the most difficult health, wellness, weight loss, and anti-aging questions. You can find podcast-specific topics like thyroid, adrenal, hormones, sleep, digestion, Ayurveda, and many more at stevencabral.com/podcasts that will then link you to your favorite Apple, Spotify, and other podcast players. Plus, all new podcasts and weekly exclusive video content is being added to our YouTube channel at youtube.com/Stephen Cabral. And that's Stephen with a PH. Head on over and subscribe so that you don't miss any of the exclusive content. Lastly, if you've ever found any of my podcasts or books to be helpful, I would really appreciate it if you could leave a review on iTunes or your favorite media player for the podcast. Rating and subscribing to the YouTube and podcast allow me to reach more and more people and help spread my mission of healing throughout the world. Thank you again for being a part of this movement.